Okay, so something huge is happening right now in medicine. You might not see it walking into a clinic or a hospital. They look pretty much the same as they always have. But underneath the surface, a massive shift is underway. We're talking about a revolution driven by AI that could completely reshape everything we thought we knew about healthcare.
And this quote, well, it gets right to the heart of the matter. This is the uncomfortable truth nobody really wants to talk about. According to the source material we're looking at, this isn't some sci-fi prediction. The data is already rolling in, and this transition, it's already started.
So this is where it gets really interesting. 85%. What is that? Well, that's the diagnostic accuracy an AI model achieved on a set of super complex clinical cases. Now get this, the accuracy of experienced physicians on those exact same cases was just 20%. That gap, that massive, staggering gap, is the entire reason we're having this conversation today. And here's a point that you just have to wrap your head around. Whenever you hear critics pointing out the flaws in today's AI, they're kind of missing the point. Because AI progress isn't this slow, steady line going up. It's an explosion. It's compounding. A human doctor spends decades learning. A frontier model can absorb all of medical history in like a week, and then it just keeps getting smarter. I mean, just look at these stats. It's not just the 85% diagnostic accuracy. An AI aced the U.S. medical licensing exam with a perfect score. It's already better than radiology trainees at reading complex scans. And here's the real shocker. In blind trials, patients are actually rating AI as more empathetic than human doctors. This isn't theory anymore. This is happening right now. So, the big question is, how does all this amazing capability lead to a potential workforce collapse? Well, the source material breaks it down with this really useful framework. The 3 domains of human ability that have basically defined healthcare for the last century. Let's dig in.
For decades, we've kind of assumed these 3 areas, thinking, doing, and feeling, were this impenetrable fortress that would always protect healthcare jobs from automation. But the argument we're exploring today is that this fortress, it's crumbling, and it's crumbling fast.
So, the first wall to fall is the cognitive one. This was supposed to be the one thing only highly trained doctors could do. But as we just saw, AI is already crushing it at diagnosis, treatment plans, writing notes, even the nightmare of coding and billing. And you have to figure, once the machine does all that cognitive work faster and safer without ever getting tired, the economic logic is just, it's undeniable. For years, the reassurance was always, yeah, okay, AI can think, but it can't do anything. That whole argument is starting to look really weak. With the recent leaps in robotics, all those physical tasks that define hospital support staff, lifting patients, moving supplies, cleaning rooms, they're all on a clear path to automation. And it's not just support staff. Even complex procedures in surgery and cardiology are no longer seen as safe.
And this slide perfectly captures the last stand, the emotional domain. We all thought empathy was our uniquely human superpower, but studies are showing AI can deliver perfect, patient, consistent validation every single time without ever getting tired or annoyed. So what's left for us? Well, it might be the one thing AI can never have, our shared mortality. An AI can't know what it's like to be afraid of dying. It can't truly understand grief or hope because it isn't mortal. This is what's left, a sacred but maybe very small piece of the pie.
Okay, so let's put some hard numbers on this. How does AI taking over these domains actually translate into real-world job numbers? This is where the models start to look pretty brutal.
This heat map tells the story really clearly. You can see the risk of job displacement over the next couple of decades. The roles in deep red, think coding and billing, they face almost certain automation. And the roles down in the blue, chaplains, palliative care, the people who operate in that emotional sanctuary, they have the lowest risk. Pretty much everyone else is somewhere in the middle.
And when you take all those individual risks and you model them across the entire US healthcare system, this is what you get. This simulation shows the median projection. You see how it stays pretty flat for a few years, and then right around 2030, it just falls off a cliff. A steep, relentless decline.
The final number from the model is, well, it's a real shock to the system. The projection is a drop from about 21 million healthcare jobs today down to around 10 million by 2045. That's a loss of 11 million jobs. And to be clear, the source says this isn't a recession. This is a structural deletion of almost half the industry.
So all of this brings us to this incredible paradox, right? This central contradiction of our moment in history. We are, at the exact same time,
creating a medical utopia and an economic catastrophe.
I mean, look at this. On one side, clinically, we're walking into a golden age. Medicine is about to get so much safer with error rates close to zero. Care will be instant, accurate, available to billions. But on the other side, for the people who work in healthcare, it looks like an economic collapse. When a new system is 10 times cheaper and 100 times safer, the market will absolutely force that transition. And millions of jobs, they might just disappear.
Which leaves us with the one single massive question. If AI is handling the cognitive stuff, the physical stuff, and even a huge chunk of the emotional labor, what in the world is left for the human clinician to actually do?
And the proposed answer here is a really profound one. It's a total redefinition of the job. The human clinician can't just be a data processor anymore. Instead, they have to become a steward of meaning. They become the human layer that guides a patient through the sheer existential weight of being sick and make sure that the cold, perfect logic of a machine is always serving human values.
And that leads to this final, really powerful thought. The future of human work in medicine, it might not be about managing data or doing procedures. It might be about holding the hand that no robot can truly replicate. A smaller profession? Yes, for sure. But maybe a more meaningful and sacred one than it has ever been.